Hi, Linda.
Hi, Christian.
So, do you want to tell these kids what you do?
I am an occupational therapist and I work in home health. And I've worked in a variety of fields. I've worked in the schools, I've worked in rehab, I've worked in adolescent locked facility for, in psychiatry, but anyway.
Do you like working?
Yeah, I do. It's definitely, has its challenges too, but it's a great field.
Do you wake up every single day and be like, wow, I want to go to my job today?
Some more often than others, but all in all, it's a great job. It's got great pay. It's a very rewarding job. So.
Do you keep in contact with the people that you work with?
My team is definitely they're my friends. Most of my friends are therapists or people in, the allied health fields like social workers or speech therapists, physical therapists for sure. They make up most of my friends.
What about the people that you treat? What do you do with them?
I don't really maintain a relationship with them because of just boundaries for client-patient relationships. Usually speaking, if it would be considered a conflict of interest if you were to treat a close friend or even a family member, you would normally defer that to one of your colleagues.
Have you ever done something that you shouldn't have when you're working?
Like speeding?
Sure.
I guess, but I do that inside of work, outside of work. No, I don't know. Do you want to be more specific?
How about when you're working, do you ever get frustrated with your patients?
Well, certainly, but there's a level of professionalism that you have to maintain. So regardless, part of being a clinician is to maintain your emotions and to keep them in check. And, a big part of it too is understanding that they have a whole process that they're going through as a patient. It's not so, like to you it's a job, but to them it's their real life, and it's affecting their independence. It puts their future into question. It's a stressful time for their family, their friends, and a lot of times it's financially stressful. So when you are working with a patient, it's really important to think of them as a whole person and not just your patient. You know what I mean?
Mm-hmm. What interested you into being what you work as?
In being an occupational therapist?
Yeah.
Well, for one, there is always a need. They just can't get enough of you. They don't have enough OTs, and so I just knew that, your job demand, you're going to be able to find a job basically anywhere. As well, I looked into just the flexibility of what kind of different settings can you work in. You can work in peds, you can work in mental health, you can work in more of a rehab setting. I like the idea of coming up with your own treatment plans and, just coming up with your own diagnosis in terms of treatment, your therapy. And I think that all in all, it's a very rewarding job. You have patients that, haven't been able to sleep in their own beds for 6 months. And to have, the ability to rehabilitate them so that they can sleep in their bed for the first time, it's just things that you take for granted that's really important to them,
Mm-hmm.
And you get to be a part of that, so. You want to sit with mine? Okay.
Have you ever considered Have you ever like considered being something else other than an occupational therapist?
I did. I went to school to be a doctor, and I went through the pre-med program. I took my MCATs, which is the medical exam test to get into medical school. I picked a university that had one of the best pre-med programs in the nation, and I did my research my junior year in college. I went to Barnes Hospital, which is in St. Louis, and I did research on a specific gene under the direction of a doctor. And ultimately, I wanted something that I could balance my profession and my family life. And I thought it might have been hard to balance that as a doctor for me. And so, you start looking into different health professions, and I still wanted that autonomy. I wanted that independence. I wanted to be able to come up with my own treatment plan and make the decision as far as when a patient should or shouldn't be discharged and things like that. And anyway, I did. I had considered that, and then somewhere along my profession, I thought maybe I wanted to go into pharmaceuticals, because that was something that my mom certainly had encouraged me to do. If it wasn't pre-med, then go into pharmacology school. And so it was probably about 7 years ago that I thought maybe. But ultimately, there's not a lot that offers the kind of flexibility for an OT with the pay that it does. And,
Yeah. What would you have done if you would have chosen something else?
That's a hard question to answer. I don't know.
You don't know?
No. I think maybe a better question would be like, what field or what, not field, but what setting I liked best. Whether it was mental health or pediatrics or rehab. And pediatrics, of course, it's fun to play with the kids.
Yeah.
And mental health, it was very challenging. And rehab is I love neurology, so that's probably my favorite. Those are probably my favorite diagnoses. So it's fun to work in rehab too.
Is that what you do right now?
I'm in rehab, but in a home health setting. Mm-hmm.
And is that the favorite place that you've been to so far? Like who you worked at so far?
It allows me the flexibility to work the days that I want to work. I work as many hours as I want to work a day. I take on as many patients as I want. You travel from home to home, and you provide therapy in the home because it's too dangerous for them to come outside of their home. There are definite benefits to it. I don't know if it's my favorite place. It's hard to pick a favorite, because there's pluses and minuses for each kind of setting. But, for instance, right now I have to drive a lot.
Yeah.
You drive from patient to patient's house. Sometimes you can sit in traffic and you might spend 2-3 hours a day on the road, so that's not fun. But the pay is really great too, so, it's a trade-off.
So do you think this job, benefits your children too at the same time?
What do you mean? In what way?
Like, does it help you with your family foundation? I don't know how to ask this question. I know what I want to say, but I don't know what I mean.
It helps me provide for my family.
Yeah, that's what I meant.
Of course, you earn a living so that you can provide for your kids, and my flexibility in my schedule allows me to work around my kids so that I could, go to work after my daughter goes off to school, and I'm home before she gets off the bus, and if I'm supposed to volunteer in her class one day, then I just won't work that day, or if she has a doctor's appointment or an orthodontic appointment, another day, then I just work around that. So I'm definitely able to take care of, the things that I need to at home while still working. And like I said, I could work 3 hours one day and 5 hours the next day, and
whoa, this is a big day.
Whatever works for my schedule. Right, buddy? Right? Does Mama go to work? Sometimes I go to work after Steve gets home. So.
Do you think one day you'll be a good role model for your children? By
One
working,
day?
well, do you think you...
Because I'm not yet.
Do you think you are a good role model for your children working as an OT?
You know, I think that whatever you do, all I want them to know is that you have to work hard and you have to work to your full. So it's not enough to say, I'm just going to do enough. You know, I want you to work to the best of your ability. I want you to do everything completely and earn an honest living. You know, don't look for shortcuts. Don't look for handouts. Yeah.
Okay. Well, thanks for letting me interview you, Linda.
You're welcome, Christian.
Bye, Miss St. Clair.